Okay. So
Okay.
this is actually going to be recorded.
Yes, it is. It's like our
Oh,
proof that we,
okay.
yeah, it's like our proof that we interviewed with someone, basically.
Gotcha. Okay.
Okay, so this is Dr. Slade Moore, an orthopedic surgeon at Novant Health.
Mhm.
Okay, so basically we can just go through the questions I have and I guess just kind of see, I mean, we can talk about other
Sure.
stuff too, but that's just like the basis of it, I guess. So the first
Okay.
question I had was where did you attend college and what did you major in?
So I attended college at Binghamton University in New York. I majored in biology. Then I went to med school in Syracuse, New York.
Yeah. Okay. So then that leads me to my next question with what was the hardest part about medical school?
Probably the hardest part was, I think the hardest part was just adjusting to it initially. And then kind of once you get into it, it becomes, second nature as far as how much work, kind of the workload, the
Right.
amount of studying that's involved, and the hours that it takes to kind of do what you have to do. It's much more intense than college. So, I mean, it consumes the majority of your time. So that's probably the biggest thing.
Yeah. Is there like a I always wonder about this. Is like a certain year in your opinion like harder than like the rest of them? Like
Um, I think probably just the first year because you're just get out of college and you're adjusting to the the amount of information that you actually have to know, and it's a significant amount more than you're kind of used to,
Mhm.
and then balancing that with a social life and free time, which tends to be limited initially. So I think it's the initial. Once you kind of get into the groove of it and you know what to expect, it's a
Mhm.
little bit easier. But
Okay.
I think the initial adjustment is because of the change in workload and the expectations.
Okay. So then I guess we can just start talking about your job now. Um
hmm
what how did you end up like choosing I guess surgery in the first place and then like ultimately orthopedics?
So when you're in med school, you do rotations after your first 2 years, which are mainly in classroom work. You then like gross anatomy and physiology and all that stuff. Then you do clinical rotations. And at the time, my thought process was to keep all options open. I actually was thinking about actually doing cardiology, but then I did my rotations, and then my first rotation was OBGYN. I thought it was pretty cool to deliver babies and that kind of thing. But then I did orthopedics, and I kind of it just kind of fit. I like carpentry. I like to fix things. I like athletics, and those kind of things kind of go together with orthopedics.
Mhm.
Um, so that's how I kind of, and I really honestly, when I did general surgery, some of the things that I saw, I was like, I don't really want to do that. So I knew it wasn't going to, I kind of, when you do the rotations, you kind of get a sense for what you like, and then you kind of choose what you kind of, everybody kind of fits into and there are stereotypical things that people like about, like, a lot of orthopedic people are into sports and like to fix things. That's kind of how it works. And I kind of fit in with it.
Was there like a close second like that you considered?
Honestly, no.
Okay.
Once I had decided, I was like, it's, it was kind of like, I didn't have like a backup.
Right.
Yep.
Okay. Okay, so I guess we can start talking about your current job now.
Yeah.
So, what does a typical day look like in the hospital for you?
So there's two things. Like, so one thing to understand about orthopedics, it's probably different a little bit than general surgery, where there's a lot of actually time spent seeing patients in the clinic. And your amount of people that you see is the amount of surgeries that you get out of the people that you see is probably the lower percentage than, say, general surgery.
Mhm.
So you see a lot of patients for, um, you know, all kinds of complaints, knee, shoulder, hip, all that kind of stuff. But the percentage of people that actually need surgery is
Right.
pretty low. But a typical day in the hospital, when I'm in the hospital, I'm usually operating. And I usually operate a couple days a week, and then in the office seeing patients the rest of the week. So a typical day in the OR, I'll do 3 to 4 surgeries. I usually focus on doing hip and knee replacements or hip and knee replacement revision, which is kind of like knee replacements or hip replacements have had problems and then they need more surgery.
Mm.
So that's my focus. And so, and then depending on the length of the surgery and the kind of the types of surgery that you're doing, as far as the difficulty and severity, will determine how long the surgeries take and how long you're at the hospital. But usually a couple days a week in the hospital, and then 2 or 3 days in the office seeing patients.
Okay, that makes sense. So do you have like a favorite surgery that you like to do, like a particular operation or something like that?
Hip replacement.
Okay.
And I can give you the reasons why.
Yeah.
So typically patients that have a hip replacement recover relatively quickly. The recovery process is less painful than a total knee. And the results of the surgery are more predictable and more reliable. It's actually one of the top 3 surgeries ever devised for improvement in quality of life, and the cost that it takes to do it and the quality of life that people get out of it. It's top 3 all time, probably top 1 or 2. So it's a really excellent operation, and patients really benefit from it significantly.
Right. Yeah. Okay. Do you have a least favorite surgery?
I would have to say anything done after about 10 o'clock at night.
Yeah.
That's usually because we have to take call. So
Right.
when you take call, like, with your dad,
Mm.
and probably less so now because he focuses more on bariatrics, but we take call, you're kind of at the whim and the will of the emergency room. So whatever kind of rolls into the ER, could be a infection, it could be a broken hip, it could be a broken femur, and depending on the urgency of it, you may be operating in the middle of the night, and nobody likes that. So if you could avoid it, that would be the thing. So anything that I like, most surgery I like to do if it's in my kind of realm of what I can do, but anything after a certain hour is undesirable.
Yeah,
So
that sounds about right. Okay, so I guess would you consider surgery like your favorite part about the job, like in the operating room or like seeing patients, like?
I think surgery definitely is probably the favorite part of it, but also seeing people that you've operated on and then seeing them get better.
Mhm.
Most of the reasons I do, actually every reason I do surgery for is because of pain. And so 99% of the stuff I do is to treat somebody's pain, and they're talking severe pain where they can't walk,
Right.
pain that is debilitating where they have to have pretty much surgery to fix it.
Mhm.
So when you see somebody after you've done the surgery and they're doing really well, that's also, very gratifying. But the actual, like if you ask any surgeon, most of the time they're going to want to be operating.
Right.
But seeing patients doing well is also gratifying, but I'd much rather be operating typically.
Right. Okay.
So,
Okay. What was the most difficult patient you have had to operate on, or like
mm,
a difficult case you've had? I mean, throughout, I guess you've
that's a
got a
tough
lot.
one.
Yeah.
I think necessarily the most difficult one was, trying to think. That's a tough one. Well, yeah, I guess it was probably be a hip replacement revision that I did on a patient that was really obese, and I didn't actually know if I was going to be able to complete the surgery because it was so difficult, and it was a struggle. It was one of those times where you're like, I don't know, and your body, things when you're operating, you could call somebody like on the phone to come and help you, but if you're really struggling, but the feeling of, man, I don't know if I can figure out how to get this finished and get it done. And so that was probably the surgery that comes to mind that was really difficult and kind of stressed the system a little bit. but it ended up going fine and ended up figuring it out. But when you're doing surgery, when I do surgery, if it's a straightforward surgery, no big deal. But if there's like a redo surgery or a more complicated surgery, there's typically, you have a couple different plans that you might need. So you have plan A, plan B, plan C, and you always obviously want to do plan A. It's usually the most straightforward and simple, but that's part of being a surgeon. You gotta kind of deal with things as they arise, maybe unexpectedly, and that can be difficult at times. So but that particular comes to mind as that patient that was that particularly difficult because of their size.
So yeah, was that like the only factor that made it like that?
Yeah, because of her leg size and positioning that you need when you do a hip replacement. You have to put the leg in a certain position, and her leg was so big, it was nearly impossible to do that.
Mhm.
So it made the rest of the surgery, and I didn't perceive it or anticipate it
Yeah.
beforehand. And so when I got in there, I was like, oh, this is going to be a problem. But we ended up figuring out and got around it, and everything went fine. But it was basically based on the size of her leg. So,
Yeah.
which is right up your dad's alley.
Yeah, that's true. Okay. So my next one would be, how many hours do you work in a normal week?
So I would say, between operating, clinic, and then kind of doing work out of being in the, not being in the office, there is some spillover, like to bringing work home.
Mhm.
I would say probably realistically between 50 and 60 hours. And then when you're on call, which I take about 1.5 calls a week, you're on the entire time. You're not working necessarily, but you have to be available. Say
Right.
for a week. So when I'm on call for a weekend, I'm on call from Friday morning to Monday morning.
Right.
I'm not necessarily at the hospital in time, but I have to be available.
Yeah.
So those weeks it's a little bit longer, but my hours are probably less than they used to be when I was in High Point. The work here is actually more benign and more better quality of life. Let's put it that way. The hours are less. So
Yeah.
50 to 60.
Okay. Yeah.
Yep.
How often, like, are you on call, like, each week?
So we share call. I think it's about 6 or 7 calls a month.
Okay.
Which calculates to be about a 1.5 a week. We take 2 at a time, and then some weeks we have minimal call. And the call here is pretty benign. We're not that busy,
Mhm.
but some places, you could, depending on where you are and the size facility that you're at, you could be on call less frequently, but much busier when you are on call.
Yeah.
So that's if you're thinking about, as a field, as a surgeon, you're probably never going to get out of taking some type of call. Whereas if you're like, say, family practice or another field that's medically related, you could actually have a situation where you never take call.
Okay.
You might have extended office hours or something like that, but you may not. Call is, if you would ask any surgeon or any doctor, if they would say, is if you can get rid of call, it would be the top of the list, but you can't.
Okay. Yeah. Okay. Do you have any like interesting or funny stories from either like medical school or residency, or I guess your job now, like any? I just know my dad would tell me lots of things from
I don't
his
know if there's any could be
residency
that be repeated on this.
days.
Trying to think. I mean, there's instances all the time. Patient interactions. I try to keep it light with my patients. I try to not be too serious. I mean, when you need to be serious, you have to be serious. But but to try to keep it light so that there's a people can relax. I'm just trying to think of any particular. Oh, this was an embarrassing. This one is pretty disgusting, actually. So, and it was terrible, but it was a completely. So it was wintertime, and I was seeing patients. I thought maybe I had a little bit of a runny nose, and I'm seeing this girl. She's like 14 or 15, and I'm examining her knee. So I'm just examining her knee, and must have had like a little bit of a runny nose. I didn't even know it, and like dripped out onto her leg while I was
Uh,
like, my nose ran onto, like, I didn't even know it. And I made some kind of comment, and like, I'm like, whatever. And then, so the next time she came in, I joked around about it, but it was kind of awkward and embarrassing and kind of disgusting, but things happen. So we moved on from it,
that is
but it was kind of disgusting.
yeah. Nice. Okay. So let me think of what I want to ask next. Um, if you could do it all over again, like, would you say it's worth like going through medical school and going through the residency and like all the schooling, all the hours? Like, would you say it's worth it?
Yes, with a caveat to that. I mean, I
Yeah.
think absolutely, especially now. Like, if you had asked me maybe 5 years ago when I changed jobs and was had other issues going on, things can get somewhat stressful at times, especially if you're having, not everything always goes well at work, as far as like your patients can have complications and you have to deal with those, and that it can get stressful. But in general, absolutely, yes. I wouldn't have it any other way. And I think that the good thing about surgery, and especially orthopedics and that kind of thing, is, you know, there's probably going to be a trend going forward with more automation and like computer learning and AI, artificial intelligence, where, you know, people are going to probably be at some point replaced by machines, at least partly. Like, because you can get so much knowledge from computer has access to all the knowledge in a split second. So there's medical fields that you might be, if you're a medical doctor, you could actually, part of your employment could be threatened by the development of better artificial intelligence. You could put it in your symptoms. They could even listen to your heart and make a diagnosis. Whereas surgery, it's going to be a long time before they develop a robot that's able to do
Yeah.
what we can do, because every surgery that we do, every person that I operate on, everybody's anatomy is slightly variant, and
Right.
it's not everything is the same. So I can see it probably happening at some point, but I think it's going to be hopefully after I retire. But I think, from that standpoint, I mean, I absolutely love what I do, but I also think from the way the medical field is now, there's probably going to be a push to develop replacements for physicians at some
Right.
level.
Okay.
Yeah.
Yeah,
Yeah.
that makes sense. Okay, so probably my last question would be, um, overall, like, what would you say if you wanted to like recommend like this career to someone else, I guess?
I would have to say, I mean, you have to decide. I mean, you could also do if you were like, say, you're on the fence, you could be a PA,
Right.
which gives you a lot of it gives you a lot of flexibility, as far as jobs. You can change jobs easier. For me to change jobs, I mean, I have to go out of the area because there's competition. There's clauses in your contract say you can't work in a certain geographical area as part of it. So if you're a PA, you can pretty much go wherever you want. Um, I'm trying to think. So what was the question?
Oh, I guess like if you were like to recommend
Oh,
this
make a
career,
recommendation.
yeah.
And I think you have to evaluate what you want. How much responsibility do you want? Do you want to be the person that helps out, or do you want to be the person that's ultimately responsible for everything?
Right.
That's part of it. So if you are, if you're the physician, or the surgeon, whatever happens is kind of ultimately, even if you didn't necessarily, like, say you're taking care of patients, it's ultimately your responsibility.
Mhm.
Whereas if you're like a PA, you are somewhat of in a supportive role. So the ultimate responsibility really falls with your person you're helping.
Right.
So that's part of it. So you have to evaluate your personality as far as that goes. And then also, like, there is probably a question of, time investment in getting to where you want to be. Is it somewhat of a delayed gratification? So you have to go through college, got to go through med school, got to go through residency. So
Right.
from your dad, I was 32 by the time I finished my residency. So
Hmm.
you think about, like, I didn't have a real job until I was like 32 or 33.
Right.
So there is a big time investment, although that time period goes by quickly because you're busy and you're doing things and you're constantly learning. But
Hmm.
there is a huge time investment that you have to take into account. So you're going to be kind of where other people might be, having a lot of fun, going out, enjoying their 20s. As more you're going to be kind of, you're going to be on a different path
Right.
than a lot of people. So that's one thing. The other thing is, as far as like having a family, and especially I think being a woman is probably harder, but it can be done. It's just, it's gonna add a different wrinkle into everything. It's going to be a little bit more challenging probably.
Right.
So as far as a career path, but I think it's definitely doable, especially now more than ever, just because of the environment and the acceptance of, people being able to take time off from work to like have a baby or something like that. So
Mhm.
I mean, I think those are the things you have to consider. And you're gonna have to sacrifice time, free time, to get where you want to be.
Mhm.
And this time that you really can't get back. But at the end of the day, I mean, I'm 100% glad that I did it.
Right.
But it's a bit of a, it takes time.
Yeah.
Yeah. Yeah.
Okay. I think that wraps up all my questions. I feel like you answered everything I asked, and I don't
Yeah.
think I have any more for
The
you.
only, I think one thing I would say too, that about college, like, so you can go to college and you could get a degree in literature or history or whatever, but you have to get your prerequisites for pre-med. So you could do
Right.
whatever. So you don't have to do, like, I did science stuff because that's what I like.
Right.
I was going to minor in anthropology, in like human evolution, but I ended up getting on the biology track and just did the major in biology.
Mhm.
But you could do whatever you want. You could do chemistry, you can even do it like engineering, but still get your pre-med requisites, and then your pre-medical requisites. And actually they probably like that, as far as
Yeah,
being
that's
the,
what my dad was telling me when we were
yeah,
talking about this, because he was saying how you're gonna get your prerequisite courses in anyways if you're on the
right.
pre-med track, so it doesn't really matter what you really major and minor in.
No, and you're going to take all those courses again. You're going to take all those courses again in med school. So
Right. That's what he was saying too. Yeah.
so you got to get your organic chemistry, you got to get your physics, you got to get your calculus, you got to get whatever the other requirements are. Certain probably biology, I think. But after that, you could do basket weaving. I
Right.
mean,
Yeah.
so as long as you do well, and you know and sometimes actually it's probably more, having something a little bit different is good.
Right, yeah, because
Yeah.
I know I just like biology and chemistry personally. Like those are just like what I like in school and like what I'm
Hmm.
good at. But yeah, because my dad was saying how, you can really do anything. And I was
Hmm.
like, well, I still do like biology and chemistry.
Yeah, so I would do what you like. I wouldn't do anything to look a certain way. You got to do because if you try to do something that you really don't like, you're not going to do as well in it.
Right.
You got to do something that you really, plus if you decide at some point that you don't want to do medicine, you're still going to have a degree in something
Right.
that you use for something that you're going to want anyway.
Yeah.
So yeah, I think that's good advice. But you got to do what you like. I mean, you don't want to try to do something just based for appearances.
Right. Right.
Yeah.
That's good. Okay, so the last thing I do need from you, and this
Hmm.
I don't think there's anything else. I'll basically send you a link to this evaluation form that I'll
Sure.
give you on my website, and you basically just fill it out. It's just a
Okay.
kind of another proof that we did the
Yeah.
meeting, even though she already has the
Sure.
video. But that should be it. But I definitely want to come
Sure.
to OR soon too. But
I don't know how that works as far as COVID. Have you have you seen your dad operate?
mhm.
Did you fill out anything to come in, or what did you have to do for that?
Yeah, I signed like a bunch of paperwork for it, and he said should still be valid.
Okay.
But
Yeah. So, I think I don't. And when was it that though? That wasn't during COVID, was it?
no,
Okay. So that's the only thing we need to
right.
figure out. I don't know if they're allowing at this point. They're probably not. I'll be honest.
Yeah.
What I could find out. I'll ask.
It's okay if it's like not immediate or anything, because normally like for our
Mhm.
project we go like I would go with you for a week and shadow you like
Right.
in person.
Right.
So we're not doing that, but I still of course like want to go in and see and stuff. But
Okay.
that's like not necessary right now for like it's not even
Okay.
part of the project anymore basically.
Yeah. I mean, I don't think they're gonna. You guys are back at school, right?
Mhm.
Full classes and all.
Mhm.
Hmm. I mean, I can look into it and see what their policy is, and then you can let me know when if you have a deadline, and we can work it
Yeah,
out.
there's totally
Yeah.
no deadline. I just wanted to, I mean, obviously if I'm interviewing a surgeon, I want to go see a surgery, but
Yeah.
um,
Yeah.
yeah, so there's no
Yeah. And
deadline.
then the certain weeks, certain days, certain weeks are better than others as far as the case mix. You want to see probably a few different things, so we can also. I could look at my schedule at some point, and then you'd probably want to come on a week where I'm in the operating room Monday and Tuesday, because some weeks will be Monday and then just half day Wednesday or something like that. So you probably want to come on a week when I'm in the OR like 2 days in a row.
Yeah,
I think that's the way to do it.
that'd be
And then
cool.
you don't want to be in the clinic that much. I mean, it's kind of gets boring after a while. So
Okay, yeah. So the only
okay,
I'll send you that evaluation link. It shouldn't
sure,
take long or anything, but that's the only
okay,
thing that I need for the rest of my project, basically.
perfect. I'll take care of it.
Okay, thank you so much again for letting me interview
Yeah,
you.